It's Wednesday, the 17th of February, 2021. Joining me on the line is Dr. Nqobile Sithole, and we're going to be talking about breast health complications. Despite breast cancer, women face various other health issues that have to do with the breasts. Let's find out what these conditions are and what causes them. Good afternoon, Dr. Nqobile.
Good afternoon, Miriam, and good afternoon to the listeners at Salam Media.
Thank you for joining us. So, take us through some of the common breast problems that women face besides cancer.
Yes, importantly to note is that about 90% of breast disorders are non-cancerous, which is actually a score looking at the burden of breast cancer in general. So these conditions are termed as benign breast cancer disorders. Importantly, for scientific or rather for diagnostic purposes, we do classify them. I'm just going to mention a few.
Yes.
So it can be fibrocystic changes, which includes the mastalgia, which is just breast pain. It can also be breast cysts, which are fluid-filled facets or parts of the breast. And it can be non-descriptive masses, which are usually on the upper outer breast. Also to note are fibroadenomas, which are benign lesions that affect the breast, which can occur in younger women, which affects teenagers, and we name those as juvenile fibroadenomas, but they can also affect any women of all ages. To note, these are non-cancerous breast swelling or masses. They are painless lumps in the breast. To also note is mastitis, which can affect women commonly after delivery, women who are breastfeeding. So this is basically infection and inflammation of the breast tissue. You can also get what we call galactosal, which is milk pouches that can actually form masses in the breast in women, say 6 to 9 months after stopping breastfeeding.
Right. And what are some of the causes of these conditions that you mentioned?
So importantly, we in the medical field we use what we refer to as an approach to these benign lesions. The reason being that in each one of them that we see, we want to exclude breast cancer. So they all mimic breast cancer. So if a woman has a mass or a lump or swelling or pain in their breast, the main thing we want to do is to exclude breast cancer. So in terms of our approach, we would look at the history in terms of durations of the symptoms, those symptoms in relation to menses, whether there's presence of pain and the type of pain, whether the woman is on any medication. As we know, hormone replacement therapy is a big culprit in the causation of breast cancer. And we also would like to know whether the woman has had any mammogram or any other screening test, in terms of excluding these breast conditions. And also in terms of examination, we always advocate for self-breast examination because a lot of information can actually be gathered from there. So it's important for one to know what their normal breast feels like. So at least twice a day, a woman should be examining their breast. And what are you looking for when you examine your breast? Is you're looking for lumps and any nipple discharge. So importantly, even when a doctor examines you, that's what they are looking for. In particular, they may ask you to do a few maneuvers like squeezing putting your hands on your hips and try and squeezing your chest. To do a more detailed examination while your pectoralis muscle is contracted, which is the muscle that is found in the breast. So notably, I'm just wanting to mention really what I'd say as red flags when it comes to our approach in terms of benign breast disorders, as I've mentioned them above. Importantly, if there is any redness and warmth, it may suggest that there is underlying infection as a cause. So it's important to seek medical attention. Any nipple changes or skin changes, when I speak of skin changes, things like what we refer to as powder orange, where the skin resembles an orange peel, is one of those flag signs to really seek medical attention. Also, when it comes to lump or breast changes which affect just one just one breast, or also if there is discharge which is also affecting one breast, especially when the discharge is bloody, it's important to seek medical attention immediately. Any pain in the breast that's worsening, that is continuous, that interferes with daily activity, not responding to over-the-counter pain medication, is important, for one to seek medical attention. As we've mentioned, that pain may be related to menses, and really there is quite a vast cause of breast pain, which is not related to cancer as such.
Mm-hmm. Now, how are they treated? Can they be treated with over-the-counter medications, or are there procedures that needs to be done for some of them?
So obviously, as we've mentioned, these red flags, if it's really just a simple mastalgia, which can be due to trauma to the breast, or which can be related to menses, as I've mentioned, which we refer to as cyclical breast pain, one can take over-the-counter medication. They can take, even your doctor may prescribe some non-steroidal anti-inflammatories. Vitamin E supplementation also has found to have improved symptoms dramatically when it's used twice daily for 2 months for cyclical breast pain. So obviously, like I said, it's an approach. If need be, the doctor might have to do other screening or diagnostic tests, things like ultrasound, an MRI scan, as well as a biopsy, depending on where the breast lump is. And at the time of biopsy, they may actually resect or remove the lump at that time. So they send it to the lab, and then the cytology or the type of cells are checked as to whether it's cancerous or not.
Mm-hmm. And can we prevent these illnesses or diseases or conditions, or should we just go with the flow?
Yeah, importantly, there is a few of them. In terms of just routine breast care, whether it's for women who are pregnant, who are lactating or who are breastfeeding and non-breastfeeding, the approach is more or less the same. You can undermine things like taking a shower daily or at least twice daily and moisturizing your breast. But in fact, these things have found to contribute to things like infections. And as I've mentioned, the importance of self-breast examination, both in males and females, we advocate and we stand for this so much, because the first person to really notice any changes in the breast is the owner of the breast. So it's important for you to be able to do a proper self-breast examination. And things like massages, actually massaging your own breast is also very important in preventing the symptoms. There is actually what we refer to as the lymphatic system. So when you massage your breast, you are helping your lymphatic drainage. So the lymphatic drainage is basically removing any microorganisms or germs by draining lymph, which is part of the immune system. Also, things like a healthy diet and exercise are quite important. And to note is that organic foods are not just something that is just about fashion, or that I live in a particular place, so I must eat organic food. But it has been linked to a lot of, in fact, chemicals that are found in food has been linked with a lot of breast conditions, including benign breast conditions and as well as breast cancer. And exercise has been found to reduce an overall of about 10% risk of breast cancer, even if it started late in life. As I've mentioned earlier when we started our topic, that we cannot discuss benign breast disorders, not looking at breast cancer. Because the moment a woman has a lump in their breast, we always think breast cancer until proven otherwise. And also, the other question that comes up is always with women to bra or not to bra.
Mm-hmm.
In fact, scientific evidence, indicates that you should wear your bra at least, in fact, for the entire 24 hours. You need to support your breast. And this is notably, avoiding wired bra, because they obviously cause you insensitivity. And, when it comes to sleeping wear, we know that a lot of sleeping wear is non-restrictive. So the aim of the bra is to support your bra in a way that your breasts are as close to natural as possible. So you don't want to wear something that's squeezing and squashing and causing a lot of discomfort.
Mm-hmm.
Smoking and alcohol is also part of breast care, as we know that both these are linked to cancers. They're linked to low immunity, which can actually predispose to some of the conditions that we've mentioned. And chemicals in beauty products, that's something that we actually don't really speak about. But it's important to note that a lot of conditions, including aggressive cancers of the breast, are actually linked to parabens, which are chemicals that are found in shampoos and deodorants and a lot of body lotions that we use. In fact, there's actually a slogan in wellness health that says, if you can't eat it, then don't put it on your body. So it's just to stress, how important it is for us to really look at those small labels that, nobody, really looks at, and all of us ignore them. If it smells nice, we just put it in our body. We don't know whether it's poison or, what it is really made of.
Mm-hmm.
Yeah, and also drugs like hormone replacement therapy. I've mentioned that it's important to try and avoid those because they are predisposing to breast problems, including breast cancer.
Mm-hmm. All right, Dr. Nqobile, that's all the time that we have. Thank you for joining us, and have a wonderful day.
Thank you.
Bye-bye.
Bye.
That was Dr. Nqobile Sithole taking us through breast health complications other than breast cancer. And as you've heard, for your